So I've been a reproductive acupuncturist for the last 15 years. During that time, I've had the privilege of treating over 7,000 fertility cases. Um, During the time when I had my clinical practice, I have always struggled with the fact that fertility treatments are so expensive, and realizing that even reproductive acupuncture is expensive. And knowing that every year 6.9 million women are diagnosed with infertility, and that recently I saw a study that showed that only 5% of women with infertility can afford treatment, like assisted reproductive technologies, IUI and IVF. Now, there's two types of women who are trying to get pregnant. There are women who are fertile who are trying to get pregnant, who can't get pregnant because they have timing issues, or their ovulation is so irregular that it's hard to predict when they're ovulating. And for those women, there is a very affordable resource, trackers. There's a lot of trackers being presented this week at the conference, and they very systematically can collect data and predict ovulation and really be of benefit to those women who are fertile, who are trying to get pregnant and can't because of timing issues. However, there's a very large percentage of women who are infertile, who have a diagnosis of infertility, and for which trackers will not be that beneficial, because if you have a 23-day cycle this week, and you track it, and next month you have a 23-day cycle, you still have the same problem that it's indicating something's not working. And so basically, in the last 2 years, we took what we've been doing successfully in our clinical practice for 15 years and have partnered with the technology team to build a technology-enabled company that actually provides assessment and intervention with the goal of trying to understand what the underlying factors of a person's fertility issues are and address them. And we call it Conceivable. If you have an infertility diagnosis, your doctor has talked to you about some of the things that you see here: poor ovarian reserve, advanced maternal age, elevated FSH, polycystic ovarian syndrome. You've heard all of these terms before. These are all symptoms of something else, right? As acupuncturists, our job is to try and understand the underlying cause of whatever it is that a person has. And so, for example, if they're not ovulating, it isn't enough just to give them Clomid. Sometimes people will need Clomid, and I'm not averse to using Western medicine in conjunction. I really believe in integrative medicine. But if you give patients who are not ovulating Clomid without addressing the underlying problems, then you increase their risk for miscarriage. We know that women who are diagnosed with infertility have as much as a 40% miscarriage rate. In our practice, we have a 4% miscarriage rate. It isn't because we have any kind of miscarriage secret sauce or anything. It's because what we do is we figure out what are all the underlying factors that are causing or contributing to the diagnosis they have, and we correct them before they get pregnant. So we are able to increase the likelihood of them carrying to term. How do we do that? This is the question, like, how in the world can you figure out what the underlying causes are? It's not that unique from an acupuncturist perspective, because this is our training, is to try to understand what's underneath that and what's underneath that and what's underneath that. If we treat the root, we actually don't have to treat almost anything else, because it's sort of a cascade effect. Everything starts correcting on its own. So some of the things we might look at are irregular menstruation, or the absence of or presence of clotting, the volume of menstrual blood, if there's too much volume or not enough volume, PMS, how the PMS presents. Do they have breast tenderness? Do they have abdominal bloating, bowel changes? Every single one of these parameters are key insights to understanding what might not be working, such that's impacting the person's ability to get or stay pregnant. So I want to go over just one of these, just to give you a sense of what I'm talking about. So if a woman has scanty menstruation, and in my opinion, after my clinical experience, an ideal volume of menstrual blood is 4 days of bleeding, in which a woman soaks a tampon or pad every 4 hours for 4 days with abundant red, fresh blood with no cramping and no clotting. All of these kind of ideals came out of my 15 years of experience of looking at, like, what do women's menstrual cycles look like when they come in, when they're diagnosed as infertile, and what do their cycles look like when they ultimately get pregnant? And so when they have a volume of blood, as I've described, and they do in vitro fertilization, and we look at the uterine lining ultrasound measurements, they're excellent, right? And when they're less than that, we see subpar levels of, thicknesses of uterine lining. So if a woman has scanty menstrual blood, say she only has 1 or 2 days of bleeding, she's usually really happy. She's like, yay, I don't have to deal with my menstrual cycle very much, just comes and goes, and it's not very much of a nuisance. But as acupuncturists, we think that's not enough blood, because if there's not enough blood in the menstrual cycle, then there's probably not enough blood populating the uterine lining for excellent implantation rates. And if she's not making enough blood, what else is going on, right? Why is she not able to make as much blood as someone who's getting pregnant regularly? And so this is when we look for the next subclinical factor. So we're like, well, where does blood come from? Well, blood's made in the marrow, right? How does marrow make blood? Well, marrow gets the building blocks for making blood from the food that we eat. So then we have to look at, well, how's digestion working? Well, two things can be going wrong with digestion. One can be the person's eating Cheetos all day long, right? Maybe they don't know what they should be eating. Maybe they don't have access to high quality food. The other person, maybe they're eating a great diet. They live at Whole Foods. They eat this fabulous Whole Foods diet, organic, clean, shop at the farmer's market. But the ability of their digestion to break their food down and catalyze it into energy and give the marrow the building blocks to make abundant, rich, high-quality blood is compromised. And finding out why that's happening is another drill down that we don't have time to go into. But I wanted to just start having you thinking about, like, oh, these are all the cascades that have to happen in order for somebody to sort of have optimal fertility. Another thing that we might look at is basal body temperature charting. So we know that you can get a lot of information from basal body temperature charting. Again, as a clinician who has seen more than 100,000 basal body temperature charts, our job is to look for patterns. And so after seeing basal body temperature, chart, we start to see that there's a lot of correlations that we can make about the biomedical diagnosis and the way that it presents in the basal body temperature chart. We don't have time to go over that today, but we'll do it for another talk. So what are we working for? What we're trying to achieve is what we call a conceivable cycle. It's ovulation that occurs on cycle day 14 with clear, abundant, stretchy cervical discharge. 4 days of bleeding, as we talked about, with fresh red blood soaking a tampon or a pad every 4 hours. No PMS, no cramping, no clotting, no spotting. Cycle lasts 28 days every single month. And BBTs that are in the low 97s before ovulation, the low 98s after ovulation. And you're probably thinking, oh yeah, mine doesn't look anything like that. And it's impossible that it could look like that. No cramping, no clotting, no PMS. But the reality is that it is possible. In my clinical experience, I would say approximately 90 to 95% of our patients' cycles will get pretty darn close to this. But it takes an intervention. It won't occur naturally. You have to figure out how to assess why it doesn't look this and make a plan to make that happen. Talked about BBT. This is, in my opinion, what the healthiest curve represents. And again, we only have 10 minutes, so we don't have time to go into every single parameter here, but I wanted to give you a sense of what we're looking for. So the Conceivable program is pretty unique. What it does is we basically built an algorithm based on what we've been doing in our clinical practice for 15 years of how we assess a patient. Once that happens, the program develops a customized, personalized program for each person who's using the program for 1 month. And that includes customized herbal formulas, customized diet plans according to the phases of the menstrual cycle, wellness strategies that have been demonstrated in the medical literature to improve fertility outcomes. As the patient goes through the program is tracking everything that they're doing. It's tracking their parameters of their menstrual cycle, their BBT temperatures, what happens to their PMS and when they menstruate. And after a month of doing the program, their menstrual cycle will get closer to the conceivable cycle. So after they have their cycle, the program then goes back and it measures. Okay, this is what the patient did. You've made these changes. Your menstrual cycle is improved by 13%. You have 16% more volume. You have 28% less PMS, et cetera, et cetera. This is what's left, and this is what we're going to work on next month. So then it starts over, and it gives a program. So we keep peeling back the layer of onion, trying to get rid of all those underlying symptoms that are contributing to the problems. So we look at the underlying problems. We use the best practices to try to intervene, and then we're able to really address and reduce the amount of fertility issues patients are experiencing, thereby increasing their ability to get and stay pregnant. So we have a proprietary line of formulas that I developed over the last 15 years. Those are an important and integral part of our practice. When I was building this with my technology team, they asked us if you had a patient who lived in Alaska who had access to no acupuncture, to no resources, there's no Whole Foods, what are the two most important things a person can do to improve their fertility? And I said, change your diet and take herbs. Take the right herbs at the right time. And so that's why it's an important part of our program. I'm not the only one who thinks this program's effective. We have many, many urologists, embryologists, OB-GYNs, and reproductive endocrinologists referring patients to us. There's a quote from Francisco Arredondo in RMA of Texas. Not only do doctors love our program, they're actually our patients also. So Dr. Amy Brown was one of our patients, also refers a lot of patients to us. In general, what we want to do with Conceivable is, I feel like it's really important to help women who are struggling with infertility to realize that we have an opportunity to actually put a lot of power back in the hands of women. Sometimes when we go through the process of being infertile, we really lose a lot of our resources to take care of ourselves, and it's our job to teach patients about that. I just want to leave you with one thought. Patients with infertility and who are struggling feel very alone and hopeless and desperate. And I want you to know that there is hope. There are resources that can help you that you can afford, and it's possible that Conceivable might be one of those, and I encourage you to check it out. Please visit us at www.conceivable.com and follow us on Twitter, because every day we are spending hours researching all the best practices in reproductive endocrinology and the wellness strategies associated with us. You will know everything that you need to know about what's happening in that world by our Twitter feeds. So thank you very much, and it's been a pleasure to be here.